To test the motor function of the facial nerve, I'm going to ask the patient to puff out their cheeks with air and prevent them from blowing air out of their mouths. So puff your cheeks out. Alright. And no air coming out means that the facial muscles are strong, and that's a positive test.
All right, so we're going to be testing the sensory function of the trigeminal nerve that can be tested in its three main divisions: the ophthalmic V1, maxillary nerve V2, and the mandibular nerve V3. So we're going to be testing the sensory nerve touch. So we're going to be using a leaf and brush up against the skin of the forehead to test the V1, the cheek for V2, and jawline for V3. All right, so we're going to close your eyes and you're going to tell me when you can feel the touch.
Now.
Yep. On the cheek.
Now.
Other cheek.
Now.
And on the jawline.
Now.
Yeah. The reaction to the leaf touching Bailey's face was good and shows full function of the trigeminal nerves and V1, V2, V3.
So to test the patient's trapezius muscle, and if it is working well with the accessory nerve to see if there is no damage, you ask the patient to shrug up and down, and then apply pressure with your arms to both shoulders. If they can continue to shrug up and down, it means there is no damage to the accessory nerve and everything is working well with the trapezius muscle. To test your patient's sternocleidomastoid strength, you just have to ask them to turn their head to the left, place your hand on their shoulder, and place your hand on their chin, and ask them to resist your movements. If they're able to resist your movements, it means their accessory nerve has no damage and works well with your sternocleidomastoid muscle.
The cranial nerves covered in this presentation included the trigeminal nerve in its three sections, and it's the main sensation nerve, and it conveys sensations of touch, pain, temperature, and proprioception from the face to the brain. The next one was the facial nerve, and it is responsible for the control of facial expressions. It also innervates the stapedius muscle, which allows sound dampening in the ear. It also has a role in sensory functions, including taste, and that goes to the anterior 2/3 of the tongue, which is done by the cordia tympani. The last one, which was the accessory nerve, and this nerve is responsible for innervating two muscles. The first one is the trapezius muscle, which is in the upper back part of your back, neck and shoulder. And then the next one was the sternocleidomastoid, which goes from the mastoid process down to the sternum side of the manubrium and the clavicle. And in conclusion, all these nerves help with facial expressions and muscles in the face and neck.